If you are over 60, there is a good chance you have felt this before. A little fatigue when walking, a slight heaviness in your chest that goes away after a few minutes, maybe shortness of breath when climbing stairs that you once handled easily. Most people dismiss these signs as normal aging, but what if they are not? What if your body is quietly warning you that your heart is under stress and you are missing it? Heart disease rarely begins with a dramatic event. It builds slowly, silently, often without pain. By the time many seniors feel something severe, the damage has already progressed. This is why recognizing early warning signs is not just helpful, it can be life-saving. I want you to understand something very clearly. Your body almost always gives signals before a heart attack or serious cardiovascular event. The problem is these signals are subtle, easy to ignore, and often misunderstood. I have spent over 2 decades working with older adults, and I have seen this pattern again and again. Patients come in thinking they are just getting older, only to discover that their heart has been struggling for months, sometimes years. I remember one patient in his early 70s. He told me he felt more tired than usual and had stopped his daily walks because his legs felt heavy. He assumed it was just age catching up with him. There was no sharp chest pain, no emergency symptoms. But when we ran tests, we found significant blockage in his coronary arteries. His heart was not getting enough oxygen. He was shocked. And the truth is, many people are, because the early signs of heart disease do not look like what most people expect. In this video, I'm going to walk you through 7 silent warning signs that your heart may be in trouble. More importantly, I will explain what these signs actually mean inside your body and what you can do to respond early while you still have control. Stay with me, because the first sign is something many seniors experience almost every day and rarely take seriously. Most people believe that heart disease always begins with severe chest pain, a crushing feeling, sudden collapse, or dramatic symptoms that force immediate action. But that assumption is exactly what puts so many seniors at risk. What is actually happening inside your body is much quieter. Your blood vessels, which act like pipes delivering oxygen and nutrients, begin to narrow slowly over time. This narrowing is caused by plaque buildup, a combination of fat, cholesterol, and inflammation. Think of your arteries like water pipes in a home. When they are clean, water flows easily. But when debris builds up inside, the flow becomes restricted. At first you may not notice, but over time pressure increases and the system begins to struggle. In your body, this reduced flow means your heart muscle is not receiving enough oxygen, especially during activity. This creates subtle symptoms, not pain, but signals. Fatigue, breathlessness, discomfort. Your body is adjusting, compensating, trying to maintain balance, but compensation is not the same as health. This is why early signs are often mistaken for normal aging, because they develop gradually and they do not feel urgent. But here is where it becomes serious. When blood flow becomes too restricted, the heart muscle can become damaged. And when a blockage suddenly worsens, that is when a heart attack happens. So the real danger is not the sudden event. The real danger is missing the slow buildup that leads to it. Now that you understand this, let's look at the first silent warning sign, one that many people ignore completely. The first silent warning sign is unusual fatigue. Not normal tiredness after a long day, not feeling sleepy. This is a deeper kind of fatigue, a lack of energy that feels out of proportion to your activity. Many seniors describe it as feeling drained after doing simple tasks, walking a short distance, climbing a few steps, even getting dressed. Most people assume this is due to age or poor sleep. But what is actually happening is that your heart is working harder to pump blood through narrowed vessels. It is using more energy to do the same job. And because your muscles and organs are not receiving optimal oxygen, your body begins to feel exhausted. It is like a delivery system that is running low on fuel. Everything slows down. This is especially important if the fatigue is new, persistent, or getting worse. I had a patient who stopped gardening, something she loved, because she felt tired within minutes. She thought she was just slowing down. But in reality, her heart was struggling to keep up with even mild exertion. What should you do if you notice this? First, do not ignore it. Pay attention to patterns. Is the fatigue linked to activity? Does it improve with rest? Second, reduce sudden strain. Avoid pushing through exhaustion. And third, speak to a doctor if this fatigue is consistent. Early evaluation can reveal whether your heart is under stress, because this kind of fatigue is not just a symptom, it is a signal. And the next warning sign often appears alongside it, but is even more commonly overlooked. The second warning sign is shortness of breath. Many people think breathlessness only matters if it is severe, but in heart disease it often begins subtly. You may notice that you get winded more easily than before. Activities that once felt normal now require effort. You may find yourself pausing to catch your breath more often. This happens because your heart is not pumping efficiently. When blood flow slows, fluid can begin to back up into the lungs. This makes breathing feel more difficult, especially during activity. Imagine trying to breathe through a space that is not fully clear. It does not block you completely, but it makes every breath slightly harder. That is what your body is experiencing. Some people also notice breathlessness when lying down or during sleep. This is another important signal. The mistake most people make is adjusting their lifestyle instead of addressing the cause. They walk less. They avoid stairs. They rest more. But avoidance does not solve the problem. If you notice increasing breathlessness, especially when it is new or worsening, it needs attention. The key action here is simple. Do not normalize it. Track when it happens. During activity? At rest? At night? Because understanding the pattern can help identify whether your heart is involved. And now, let's move to a sign that often feels harmless, but can carry serious meaning. The third warning sign is chest discomfort. Not pain, but pressure, tightness, or heaviness. This is where many people become confused. They expect sharp pain, but instead they feel something vague, a mild pressure, a sensation that comes and goes, sometimes in the chest, sometimes in the shoulder, neck, or even jaw. Because it is not severe, they ignore it. But this discomfort is often the heart asking for more oxygen. When blood flow is reduced, the heart muscle sends signals, not always as pain, but as discomfort. Think of it as your body's early alarm system. One patient described it as a weight on the chest that disappears after rest. He ignored it for months until it became constant. What should you do? If you feel recurring chest discomfort during activity that improves with rest, take it seriously. Stop the activity immediately. Do not push through. And most importantly, seek medical evaluation. Because this is one of the clearest early signs that your heart is not getting enough blood. And the next warning sign may appear far from your chest, but it is just as important. Now, before we continue, I want to ask you something simple. Have you noticed any of these signs in yourself? Fatigue, breathlessness, or chest discomfort? If yes, even occasionally type yes in the comments. And if you are watching for a parent or loved one, tell me their age. This helps bring awareness not just to you, but to others reading as well. Because awareness is the first step to prevention. Now let's move to another important sign. The fourth warning sign is swelling in the legs, ankles, or feet. This is often dismissed as a circulation issue or standing too long, but in many cases it is related to heart function. When the heart cannot pump efficiently, blood begins to pool in the lower parts of the body. Fluid leaks into surrounding tissues, causing swelling. This is why your shoes may feel tighter. Your socks leave marks. Your ankles appear puffy. This is not just discomfort. It is a sign that your circulation is not moving properly. The action here is simple but important. Monitor swelling patterns. Does it worsen by evening? Does it improve with elevation? And do not ignore persistent swelling, because what happens next can affect your stability, mobility, and independence. The fifth warning sign is dizziness or lightheadedness. This can feel mild, like a brief imbalance when standing up, or more noticeable, like feeling unsteady while walking. Most people think this is related to blood pressure alone, but in many cases it is a sign that your brain is not receiving consistent blood flow. When the heart cannot maintain stable circulation, your brain experiences brief drops in oxygen delivery. This leads to dizziness. This is especially dangerous for older adults because it increases the risk of falls. And falls are not just accidents. They can lead to fractures, loss of mobility, and long-term health decline. I have seen patients who ignored occasional dizziness only to experience a fall that changed their independence completely. So what should you do? Do not ignore even mild dizziness. Sit down immediately when it happens. Avoid sudden movements. And if it occurs frequently, seek evaluation. Because this is not just about balance. It is about blood flow. And now we move to a sign that often appears quietly, especially at night. The sixth warning sign is poor sleep or waking up feeling breathless. Many seniors believe sleep issues are normal with age, but waking up suddenly, gasping for air, or needing extra pillows to breathe comfortably can be a sign of heart strain. When you lie flat, fluid distribution in your body changes. If your heart is weak, it cannot handle this shift efficiently. This leads to breathing difficulty during sleep. Some people also experience frequent waking, not realizing it is linked to their heart. The action here is awareness. Pay attention to how you sleep. Do you wake up tired? Do you feel short of breath at night? If yes, do not dismiss it, because nighttime symptoms often reveal what daytime activity hides. And now we come to the final warning sign, one that many people overlook completely. The seventh warning sign is a persistent, unexplained cough or throat irritation. This may sound surprising, but when fluid builds up in the lungs due to poor heart function, it can trigger a chronic cough. This cough is often dry, persistent, and worse at night. Most people treat it as a respiratory issue, but if it does not improve, it may be related to your heart. Now let's bring everything together. If you are over 60, these are the signs you must watch closely. Unusual fatigue, shortness of breath, chest discomfort, leg swelling, dizziness, poor sleep or breathlessness at night, persistent cough. You do not need all 7. Even 1 or 2, if consistent, can be enough to justify evaluation. What should you do starting today? First, observe your body honestly. Do not dismiss changes. Second, reduce strain. Avoid overexertion until you understand what is happening. Third, seek medical advice early. Early detection changes outcomes. It gives you time to adjust, treat, and protect your heart before serious damage occurs. Because once a major event happens, recovery becomes more difficult. But before that point, you have control. Let me leave you with something important. Heart disease does not usually begin with a crisis. It begins with quiet signals that most people ignore. Fatigue, breathlessness, discomfort, small changes that seem harmless. But your body is not trying to confuse you. It is trying to protect you. The difference between those who recover and those who struggle often comes down to one thing: how early they respond. If you take one action after watching this, let it be this. Pay attention to your body today, not next month, not after something gets worse. Today, because early awareness gives you options. It gives you the chance to protect your independence, your mobility, and your quality of life. If you found this helpful, share this video with someone over 60 who needs to see it. It may help them recognize a warning sign before it becomes serious. And if you want more clear, doctor-guided insights like this, simple, practical, and focused on protecting your health as you age, make sure to subscribe. Take care of your heart. It is working for you every moment. And the earlier you listen to it, the longer it will take care of you.